This is Radio Health Journal. I'm Nancy Benson. This week, tracing the contacts of people with COVID-19. How far can we go?
Does walking by someone in the grocery store constitute a contact, or do you really have to have some sort of interaction with them?
Getting tough with contact tracing when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
So I try to give the Rangers their due, talk about their heroism, but on the other hand, I want to talk about some of the atrocities, some of the misbehavior, some of the things they did that they should not have done.
Examining the Texas Rangers of the past. Then,
the world now knows what I did today, so why do I have to write about it in my own personal space?
The evolution of social media into an online public diary. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Sometime in the next few months, you may get a knock on the door or a phone call from someone wanting to know where you've been lately and with whom. It's not the police, it's a contact tracer, tracking down those who've rubbed elbows with people newly discovered to have COVID-19. And unlike what's gone on the past few months, they may not let you go about your business, even if you feel fine. You may be told to lock yourself away for 2 weeks, seeing absolutely no one. It's the strongest weapon public health experts have to stop the pandemic and the strategy they're starting to pursue.
Our research shows that when we have the level of intervention for individual quarantine, where nearly all contacts are traced, so about 90%, and they're done so in a very rapid manner within half a day, and we have very effective isolation, so again, about 90% or higher effectiveness. Then we found that 96% of the time, individual quarantine was able to stop the epidemic.
That's Dr. Lauren Childs, Assistant Professor of Mathematics at Virginia Tech University, who specializes in understanding the spread of infectious disease. She says to beat the virus completely, all contacts of anyone who's COVID positive would have to be quarantined, ideally not at home, where family might get in the way of isolation.
Individual quarantine, the idea there is that you separate an individual believed to have been exposed to a disease but not currently showing any symptoms, and to do it in sort of the most stringent way possible. That would involve separating that individual and putting them in some private space where they're not interacting with anyone else. And in order to do that, obviously, there would be some amount of resources that would need to be given towards providing them with the essentials that they need during that time period. And potentially there would be some resources in some level of enforcement, ensuring that they aren't actually leaving that quarantine that they're currently in.
To shut down the virus, contacts need to be isolated just as firmly as people who are COVID positive. The resources required for that could potentially include hotels and food for thousands and thousands of quarantined people who may never get sick. So, Childs admits it may be unrealistic.
There's been some thought that maybe a less stringent version of individual quarantine could be perhaps this isolation at home, where individuals who believe to have been exposed are, only interacting with their family unit. Of course, that potentially puts their family unit at risk as well. So that's why it's not as stringent as this complete separation.
But even without buying up hotel rooms for quarantined people, the investment for contact tracing and isolation would be large. The Johns Hopkins Center for Health Security estimates that health officials will need to hire and train more than 100,000 people nationwide to track down contacts of COVID-positive people.
When you know that someone is infected, then you want to trace all of their contacts, and you want to do that as quickly and as completely as is possible. And so obviously that's going to be related to how many different things an individual has done over the course of time since they were believed to have been infected. And that's also where other mitigation strategies, such as the social distancing, really act synergistically. So while many of us are working from home, for example, then we have less contact, say, with our work colleagues than we otherwise would have. So those are individuals that we would not need to be contact traced under the current interventions. And so if there are fewer people to contact trace, that can be done more effectively and more efficiently.
However, there's still some debate over just what being a contact means. Loosely, it's whoever a person's come in contact with since they were believed to be infected. But how close a contact do they have to be?
This could be an individual thinking back, okay, which locations did I visit? Which individuals did I have an extended, say, conversation with or interaction with? And in practicality, different limits are given towards what actually constitutes a contact. Does walking by someone in the grocery store constitute a contact, or do you really have to have some sort of interaction with them? And you would never be able to even trace all of those contacts, because if you really wanted to make contact sort of anyone that was in a 6-foot radius of you, that would be untenable in pretty much any situation. In those very brief socially distanced interactions have very low risk with them, which is why they're permitted in a sense.
And even if some contacts are allowed to walk away, Childs says everyone we track down makes other strategies like social distancing more effective.
Every time we do that, we reduce the burden of infections that are in the population, which reduces how many more new infections are going to be created. So this sort of, even if it by itself is unable to, at a certain point in an epidemic, to completely stop the epidemic, it can be used to mitigate and slow down the epidemic, and then used with other mitigation strategies such as social distancing. So even if we're only able to trace some fraction of the people who have had contacts with a known case, then our research shows that we can still really reduce the possibility of onward transmission by that individual. And then it comes down to the question of whether it's appropriate to devote limited resources to that effort rather than to other efforts. That's something that's going to have to be the judgment for public health professionals who are overseeing it and really know the status in their area.
But where does testing fit in? If you're a contact and you test negative for the virus, does that mean you're in the clear? Childs says not necessarily. So while testing has a role, it may be more limited than you think.
Testing negative for virus on a particular day tells you that you are currently not shedding virus. But it doesn't say that in a week, if you had a recent exposure, maybe you will be shedding virus. And that's the reason for that 14-day quarantine period is that if you test people too early after they were exposed, they may not have developed the virus sufficiently to test positive yet.
So later on this summer, or especially if we start seeing another wave of COVID in the fall, don't be surprised to hear from a contact tracer.
If a contact tracer would reach out to someone and tell them that they've been around someone who has been infected with COVID, that even if they're feeling fine and if they test negative, they should really follow the advice of that contact tracer if that's to isolate for a given period of time, for example. Because if not, then that person may be part of the problem spreading the virus without even realizing.
You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
You want to say to the person, or sometimes there's an instinct to say, well, why can't you just eat? But for that person, the behavior is a coping mechanism. It's a way of dealing with deeper issues.
People who are addicted to clean eating.
Then, summertime is tick season, and they can cause more harm than you think.
If you have tick paralysis and the tick is not removed, death is possible.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.